Well, across the country, food costs are rising faster than people's incomes, causing, of course, financial stress, which impacts mental health. Many families are faced with making those tough decisions between affording food, paying other things like rent, heat, and even medicine. That's why the United Way is tackling food insecurity by connecting families to healthy meals, expanding local food access, and building thriving communities. Heather Black, Vice President of the 211 System Strategy at the United Way Worldwide, joins us to discuss food insecurities and its impacts on families and communities. Heather, thank you so much for joining us.
Thank you for having me. It's great to be here.
Absolutely. So, of course, people hear United Way all the time, but exactly what is United Way and how are you supporting communities?
Sure. So United Way is an organization that's been part of our country's history and the world for a long, long time. We've been in existence for 138 years with our commitment to mobilizing the caring power of communities to advance the common good. And we're present in so many places, in 95% of the U.S. and in 30 countries around the world. But here in the U.S., we really focus on being present in communities, focusing on our neighbor-to-neighbor approach to help communities thrive.
Mm-hmm. So what are some of the challenges you're seeing in communities that you guys are helping out?
Well, I think as you mentioned, folks are making less or are not having as much to stretch, and we all know that costs are rising. So the cost of living is increasing much faster than wages are increasing, and families and households are having to make difficult choices as to what they spend their dollars on and to stretch those dollars for all the many things that we need to just have a healthy, thriving household in our communities.
Yeah. And over the last few years, of course, the word food insecurity has changed, right? People making less money, even people that are working 9 to 5 and even 2 jobs, 2 incomes are struggling. So what is the 211 data telling you?
Yeah, so our 211 data tells us that folks are struggling to meet the very basic of needs. So in the 211 world, and just to kind of share what 211 is for folks who may not know, 211 is simply that phone number, just how many of us know to call 911 and a life or death emergency. Folks can call 211 when they need help meeting their basic needs. And what we're finding from 211 callers is that they're having trouble paying for housing, paying for utilities to keep their homes cool in the summer and warm in the winter, and paying for food. And those are the top 3 needs that we're hearing across the board, and we're seeing that those needs are increasing year over year. We talked to about 45,000 people a day across the nation contacting 211, and that's what people are telling us they're struggling to do, is to pay for their housing, their utilities, and their food.
45,000 a day is what you said?
Yeah, nationwide, 45,000 interactions a day handled by the 211 system.
Wow. How about here in Maryland? Do you know that statistic or no?
I actually don't know that off the top of my head, but you can typically find that out by going to some online dashboards. Most 211s have one. So if you go to 211.org, you can then find your local 211 and find out what information they share online.
What other factors contribute to food insecurity? Would it be like a food desert? Certain communities don't have access to grocery stores and things like that. So what other contributing factors are there?
That's exactly it. It's what kind of access you have based on where you live. The zip code you live in has a great factor onto what kind of access to food you have. Do you even have transportation, or are you homebound? Are you able to get out of the house to go and find food? So that's, again, where 211 helps connect you to those local resources. And you alluded to this, but food insecurity can touch all different members of our community. It can touch a family with young children who are struggling with the financial aspect. It can touch an older adult who's homebound, or someone with a disability who doesn't have the ability to get to a store. It can touch, again, someone with a disability who doesn't have the capabilities to prepare food. So there's a lot of different ways that food insecurity can impact someone. But I think we all know that if you don't have nourishing food to eat, it can then also compound in a lot of other areas of your life.
Yeah. And with that, what are some of the other impacts, of food security for not only individuals, but families?
Yeah, so again, I think you think about a kid going to school hungry. They're not going to be able to learn as well and to perform and to excel in obtaining their education. In the same vein, you think about somebody going to work hungry. Are they going to be able to perform as well? And of course, our older adults and our seniors who, if they don't have access to healthy food, any of us, but especially our more vulnerable older adults, can have, significant health impacts. We think you mentioned again about food deserts. We think about someone who lives in an area where they don't have access to a grocery store with a variety of options. Maybe they're dependent on a convenience store or a gas station as a source of food. That's not going to offer them the healthy options that they need so that they can live a healthy life and not potentially have additional health impacts.
Right. So what are some of the programs the United Way is offering to address this unfortunate issue?
Yeah, there's some great examples across the network. So on a national level, we've leveraged our 211 system to help people get access to food being brought to them. So in a partnership with DoorDash, we have a program called Ride United, where we're actually delivering food to people's homes as part of an add-on to those deliveries. And also using a partnership with Lyft to get people places when they need help getting to those places, especially to medical appointments, more in that case. In South Carolina, they're doing some incredible work by partnering with health clinics to actually set up what they're calling food pharmacies. So, we think of going to a health clinic to just get our medical conditions treated,
Right.
but they're looking at it as a more holistic approach. Don't just send someone home with the medicine prescription, but also sending them home with that healthy food straight from that medical appointment. And they're finding that when they screen those individuals, more than half of the individuals going to those health clinics are needing those healthy foods to go home with them so that they can have a healthy approach.
Yeah.
One other great example is community gardens in Iowa. They're planting community gardens and helping to really focus on those areas of high poverty to ensure that people have access to healthy fruits and vegetables.
Absolutely. So last question. When someone calls 211, what should they expect? How does it actually help people?
Wonderful question. So again, I mentioned earlier, we're talking to 45,000 people across the country every day. When you call 211, it is a free and confidential phone call. You will be met on the other end of the line with a warm, caring, compassionate individual who's been trained to help you. They have a large database of resources that are in your community where they're going to look up and find the information to help meet your need. Our goal is to help you navigate to the right place, to save you the stress and the time of trying to figure out what's available in your community to help you. So they're going to give you that information, give you those referrals, and help you kind of think through your plan to tackle the needs that are facing you. So that's 211. We are here 24 hours a day, 7 days a week. It is a multilingual service. We're going to be able to help you and meet you where you are, doing everything we can to help you to problem solve and get on your way of meeting those needs, because we understand times are hard. And United Way and 211, we are here to help you and get you and your family back on track.
Absolutely. One more question. I lied. 10 seconds or less. How can viewers and listeners get involved to help with this need?
Absolutely. Go to unitedway.org and look up Find My United Way, and you'll find volunteer opportunities, ways that you can support 211 and United Way in your community, and we'd be so grateful for that help.
All right, Heather, thank you so much. We'll leave it right there. When we come back, we'll take a closer look at hunger right here in Maryland. Please stay with us.
The impact of a meal goes well beyond feeding our bodies. Food can open endless possibilities for people to thrive. Because when people are fed, futures are nourished. Everyone deserves to live a full life. And with your help, together we can end hunger. Join the movement at feedingamerica.org/actnow.
We're all just trying to keep things running for those who rely on us. That's why we don't have time to be sick with the flu.
We don't have time for delays.
We don't have time for spills.
Next.
We don't have time for setbacks. Let's be real.
Getting the flu shot
Helps you fight the flu.
Get a flu shot for yourself and those around you too.
Well, hunger affects all of us because it weakens families and our state's ability to thrive. For more than 45 years, the Maryland Food Bank has been leading the fight against hunger, working alongside a network of community partners to ensure that Marylanders have access to the food that they need. Yet despite these efforts, too many of our neighbors, including our kids, families, and seniors, are still struggling to put healthy meals on the table. Rising costs and other barriers mean that food insecurity continues to touch communities in every corner of the state. Elise Krickow, Chief Philanthropy at the Maryland Food Bank, joins us to share their missions, programs, and needs. How are you?
I'm well, thanks for having me.
Absolutely. So let's dive into numbers. Just how many people are hungry in our state?
Right now, the Maryland Food Bank estimates that approximately 1 in 3 people in Maryland are considered food insecure.
1 in 3. That, based on population, is that a large number of people, or?
We have about 6 million people in our state, and so about 2 million are considered food insecure, and that's just based on research. It could be more.
Got it. So what are some of the contributing factors to that?
We have a high cost of living here in Maryland, and inflation has not subsided since the pandemic, so it's really tough. So based on wages, cost of groceries, utilities, all of those things impact people and their ability to put food on the table. Right. They're making trade-offs, and so we're here to help reduce some of that.
So it's not really just people that may be unemployed, like the average family that mom and dad are going to work, or the single parents going to work, they're still struggling, right?
Many of the people are actually working, and that's what people don't realize is people have low wages, and so they're having to choose between healthcare, utilities, rent. Right. And so by going to get food assistance, they can help reduce some of that stress on their budget.
Right. Let's talk about the health aspects of food insecurity, right? Like in certain communities, yes, you have your pockets of fast food restaurants where you're quick and easy, but of course that's not healthy.
No.
So how's this affecting people's health?
So we're very committed to getting nutritious food out to our neighbors. And so we have different ways of doing that. So if you look in some of the neighborhoods, right, there's only a corner store. So we have pantries, we have a program called Pantry on the Go as well, where we're getting fresh produce out to these communities so they have access to it. Because for some folks, it's hard to get the healthy food options to put on the table.
How big of an issue are food deserts in the state of Maryland?
It's a big deal. There are places where there are no food retailers. There are also places where there are no brick and mortar pantries, shelters, or soup kitchens. So we also have a program called our mobile market where we're going into areas where there is nothing. And it's a pop-up mobile market where people can shop the truck and get produce, protein, and other shelf-stable items.
Where are some of those areas that are most affected by that?
A lot of those areas for the mobile market are rural in nature, and so we go out to the Eastern Shore, out to Western Maryland primarily, and then in areas like Baltimore City, that's where we have our Pantry on the Go opportunities, as well as a lot of our pantries, which also include school pantries at community schools.
Right. How big of a scale is the food bank working on right now?
So we support the entire state except for PG County and Montgomery County.
Why not those counties?
Those are actually covered by Capital Area Food Bank, which is within the Feeding America network.
Okay.
So we take care of the rest of the counties within the state, and we do a in a variety of ways. So we try to really meet the community where it's at. We take a regional approach. So we have West, East, Northern, Southern, and then Baltimore City. And we have programs, team members that work within those specific communities with our partners to identify what should we be providing in those areas. So it's very custom and based on the needs of the community.
Right. What are some of the other things outside of the food bank that families can focus on to make sure they're getting those healthy meals?
In terms of
like being able to have access to that stuff. Say like they can't get to you guys soon enough, or it may be in between when you guys would service that area. What are some of the other things they could do?
we have a website, so if folks are needing food right now, they can go to our website to find food, and they can find different partners that are located near where they live. Right. So we have multiple partners. We have about 780 community partners throughout the state. And so if folks have a hard time getting to one, they can access another one in terms of that.
Right. Holidays are coming up. Of course, everyone wants the ham, the turkey, and all that stuff on their tables. What are you guys doing to help with that?
So every year we pack and distribute 25,000 holiday boxes.
Okay.
Each of these boxes has everything that you would need for a holiday dinner, and we pair it with a turkey, a frozen turkey. And so those go out throughout the entire state. We source funding from our corporate partners to underwrite the cost of those boxes. They're about $40 a box.
$40 a box, but it's free to the recipient of the box.
It is
right?
free.
So with that, is there like an income requirement or guideline, or is this open to anyone that may need assistance?
For us, it's really about showing up if you need the help, and not looking at income or things like that. I don't think people realize what it means to wait in a line to get food.
Right.
And so for many people, having to do that isn't ideal.
Right.
During the pandemic, the height of that, people were waiting for hours to get food. And so I like to reduce the stigma on that and also say that it really isn't about trying to get access to something. It really is people need it and they have to go and do that. And for some people right now, it's the first time they've had to access food assistance.
Do you still see people struggling with that? Like, wow, I have a 9-to-5 job, but I have to stand in this line for food. So do you still see that stigma sticking around?
We're trying to reduce that stigma. And so working with our partners, we're trying to create a very dignified experience. And so we have certain community partners that offer what we call a neighbor choice pantry. So it's like a shopping experience. So the more that we can set up pantries like that, you can shop with a cart, you can pick what you need. It's something that, you know, oh, I need peanut butter or I don't need peanut butter. It really, really improves the experience. We want neighbors to feel like, listen, we're here to help. This is not meant to be a negative experience.
And speaking of help, last question, how can people help your cause?
People can help in a variety of ways. People can obviously donate financially to the Maryland Food Bank, but they can also volunteer. We need people to help us pack those holiday boxes and other types of foods. And we also love for people to reach out and build awareness about the Maryland Food Bank, be it calling your legislator to talk about how important food insecurity is to you, or just, you know, letting people know that you're a hunger advocate.
Awesome. All right, Elise, we'll leave it right there. Thank you so much for joining us. To learn more about the Maryland Food Bank and how it addresses food insecurity, visit marylandfoodbank.org. After these messages, we'll take a closer look at how food insecurity affects children and how the group No Kid Hungry Maryland works to ensure that children are fueled to learn, play, grow, and have healthy lives.
I don't remember how it started. Our back and forth. Victory. Fumble. Repeat. It always came back. You probably don't remember what you told me.
That was perfect.
But I heard every word.
Nice.
Eyes forward. Don't drive distracted.
Well, families with growing kids face a constant dilemma when trying to keep their children with clothes on their backs and food in their stomachs. Many Marylanders are just one minor emergency away from facing hunger. Maryland is one of the richest states, yet 31.5% of kids in Baltimore City are food insecure, and in Howard County, one of the most richest communities in the nation, that number is 9.1. Aisha Holmes, director of No Kid Hungry Maryland, joins us to provide insight about this growing problem. Thank you so much.
Thank you for having me.
So let's talk about this problem. Why is it such an issue?
The cost of food is rising faster than incomes. And food is not the only cost that's rising. Right. So families are facing dilemmas and having to make very difficult choices about what gets to the table and whether or not there's gas in the tank to get to work in the morning. And so what we did a survey over the summer about at the end of July, and 7 out of 10 families in the state of Maryland are reporting to us that they are making hard choices. And these are families that make upwards of $100,000 a year. And so the choices are so difficult. Do you get your kid a full backpack for the new school year, or are we having healthy meals tonight for dinner?
Do you get them comfy shoes, or do you put something in their belly?
Yeah, gas in the tank. And the emergencies are, we asked families whether or not a $200 emergency would make a difference for them. Over 60% of families told us that would be a very large impact on their budget. And so people are running very tight. And $200 is sometimes, you know.
$200 can get you evicted.
Absolutely, yes.
Wow. So, of course, there were a lot of government cuts that came out of Washington. Has that affected what you're doing?
It has not yet. We are encouraging every family with every child that has the availability for school meals to take advantage of school breakfast and school lunches. In the summertime, we work really hard with our school systems, both in urban and suburban communities, as well as in rural communities, to make sure that children have access to summer meals. And in addition to that, we work closely with the State Department of Education, as well as the Department of Human Services, to ensure that Maryland is maximizing the summer programs that are available in addition to the SNAP. So it's called Sunbucks in Maryland, summer EBT, and last year over 600,000 children benefited from that program, which gave $40 a month to each family, which doesn't sound like a lot, but it can make the difference.
So I know your group does surveys. What are some of the other things you're hearing from people?
We're hearing that the stress of the cost of food and the cost of living is creating a real impact on people's stress levels and their mental well-being. And that is concerning, because we want people to be able to feel good about what they're doing and the choices that they have to make. And when you are making those difficult choices, and there is no good answer, that's really hard.
And of course, as a parent, it's something you don't want your kids to see you go through, right?
Absolutely.
So you're kind of hiding that from your kids.
You are, right?
You're just bottling that up.
You want to protect your kids as best you can from that stress.
Right. So let's talk about the hardships, right? Kids are expensive, especially as they get older, right? So, like, you can't still shop at Baby Gap when they're 13 or 14. Clothes are expensive, things of that. Are there other programs that help with not only the food part of it, but the other necessities that you guys do?
Yes. So, for example, we work with your guests, the Maryland Food Bank. We work closely with them around food. We also work with school systems, assist with pantries, and make sure that families understand how to connect resources. That's a huge part. This is a social safety net, as I have come to say over the years. And as all these pieces connect together, that's what holds families together. And it really doesn't matter whether we're well off or whether we're struggling financially. At the end of the day, we all need to be able to come together to make sure that we're all okay.
And let's go back to you know, one of the counties, 9.1%, which is one of the
Howard
richest,
County.
Howard County,
Yes.
one of the richest counties. Are you seeing people from that county maybe ashamed to reach out for help? Or
what I would
how's that?
encourage folks in Howard County is if they have needs to reach out. There is a food bank in Howard County, and the Community Action Council in Howard County is extraordinary. And they do a lot of work to help connect the dots. And they have a great Office of Community Resources there in the county. So I think that partners are coming to the table. They're wanting to make a difference. They understand the challenges. In fact, I would bet we're all living the challenges, right? And so we want to do what we can to help our neighbors and make sure that people are able to survive these challenging times.
Yeah, I mean, luckily my kids are grown, but you know, just looking at rent, electric, and then, well, I still have to buy groceries, right? I still have to put gas in my car to come to work to be able to get here. So yeah, I think we all feel it.
Yeah.
Tell me about the Sunbucks program.
Yeah, the Sunbucks program is extraordinary. It started last summer, not this summer, last summer. And we were very excited because it's a national program and it makes sure that children who are living in communities that are sometimes not as well served are able to receive $40 extra a month, up to $120 a year in their summer benefits. And that will allow for families to receive what is equal to what a school meal would provide them over that period of time. So it was a terrific program that was launched, something that was advocated for decades, and we're really happy. The governor in the state of Maryland has been incredibly supportive and has made sure that we're able to make that one of the best states. Maryland is one of the best states. We have one of the highest rates of uptake on that program, so I'm happy to say that.
Awesome. You took my last question out of my mouth because you said the governor is already involved. So.
He is.
Yeah.
He is. And we are very, very lucky that there's general support, not just within the governor's office, but also within the Maryland legislature.
Awesome. Aisha, we'll leave it right there.
Yeah,
All
thank
right.
you.
Thank you, and thank you to all our guests today. To learn more about childhood hunger, its impacts, and how you can support those working to ensure that no child goes hungry, visit nokidhungry.org. Thank you for making community connections to ensure that no child, no family, no community has to deal with the challenges of food insecurity.